Wende Parsley with Jeremiah School of Law Education, and today I'm here to talk to you about pharmacogenetic testing. That is the testing that you can have done for yourself or your children that takes into account their genetics when figuring out which medications will work and which ones will not. This is the coolest thing because whether you have had your genetics tested or not, they swab the inside of the mouth, and then ours in this case took about 3 weeks to get back. It comes back with some of the genetic markers, and it tells you how these medications work, which ones will, are the standard precautions, which ones you should use with caution or maybe not use, and then which ones you should absolutely avoid. What happens is, if genetically you don't metabolize or use the medications the way that they're intended, your body just doesn't the way that it works, then you get very many of the side effects with not any or not much benefit of the medication. So we have one of those kids that they've looked at his behavior and said, oh, he needs something for attention, or he needs something for anxiety, he needs something for whatever it is. And then when he takes the medicine, it's explosive. He either looks like he has full-blown Tourette's, or he has tremendous anxiety and he's running away and drove his bicycle in front of a car one time. Just anxious. It made him 10 times worse than he was before. So none of the intended thing. One of the medications was supposed to help him sleep at night and then help with the anxiety the next day, and he didn't sleep for 2 days. So clearly that didn't work. Didn't do anything for his anxiety. And wouldn't it be great if we weren't guinea pigs for pharmaceuticals? That's right. Wouldn't it be great if we and our children weren't guinea pigs for pharmaceuticals? Now, pharmaceutical companies do not like this testing, because it does away with the guinea pig thing. So maybe you buy 10 different medications, take them for a day or two, maybe a week, and go, okay, this didn't work. Well, they still got your money. So it would be really great if you had at least a hint ahead of time. This is the report we got back. It took 3 weeks, and it gives I don't know if you can see this, but it gives 3 columns. It lists the medications by grouping, whether they're for high blood pressure or cancer or mood stabilizing, ADHD, any of that. And it gives you a list of what the medicines are called. And these are standard precautions. This is use with cautions. I say don't. And this over here is really, really avoid it. Can be life-threatening. So I really want to encourage everyone. We got this done at our son's psychiatrist office. They did this. His pediatrician also does this test. So it should be relatively easy to find someone that does the test. This one is called Logix, Logix, and it worked really well, where the one that we did at the pediatrician's office did not work. They did it twice, and for some reason it was inconclusive. So this one worked better for us. But I would say, by the way, it costs nothing. That's right, it costs nothing. So the doctors make a little bit on it. Whoever is selling the test, I suppose, makes a little bit. Insurance pays, and you don't pay anything. So that's good news. And highly recommend this if you're trying to figure out. We get a lot of messages saying, what kind of medications do you use? There's all these talk boards, chat rooms about which medications work for your kid and which ones don't. And it's so impossible to predict ahead of time without having some kind of genetic information. We know with our kids that there's something genetic going on because they are a little bit different. And so all of that can be traced back to genetics, which, by the way, you can test by going to 23andme.com and getting the genetics. But beyond that, this helps you pick medications. So I'd like to encourage you to do that and stay strong. You're fighting for your kids.